Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill Smith.
Welcome back to FIRRIMup Doctors, Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Okay, so now I'm going to go ahead and I'll introduce our FIRRIMup doctors. We have Dr. Angela Yakey and Dr. Kathleen O'Neill Smith.
Hi, everybody. Thank you for joining us again. It's week 19. Can you believe it? It's week 19 of this. Hi, Dr. Kathleen from Boston. How are you?
Hey, gold medal team, week 19. Let's go. We're going to keep, we're never going to stop until it's over. Let's go.
Spoken like a true Olympian. I don't know if this crowd knows that you qualified for the Olympics in the 1980s, and there is a day named after you in Boston.
Oh yeah, I have to show you my little plaque. I never showed that to you.
You'll have to bring it next. Bring it next week. It's really, really cool. A Kathleen O'Neill Day in Boston in the 1980s.
As if anybody really needs to know.
So what Dr. Kathleen's saying is it's a marathon and not a race. And obviously we've made it past July 4th, and now we're trying to aim for Labor Day. We are in the thick of it in Gainesville, Florida, in North Central Florida, Dr. Kathleen.
I know you are. We've been here, and I'm with you in the thick of it. And it's great to have been there already, because we can continue for things to get better, for sure. They're better here, they'll get better there, and we have a lot to tell about what we can do to get better today.
Yeah, next
One
slide.
of my favorite talks. Yeah.
Here's where we started. Barely any red spots, and here we are today. Nicole, next slide.
Mm-hmm.
So look, it's all over Florida, and you still have a lot of red up there, Dr. Kathleen, in Massachusetts.
No, well, the red doesn't really go away, because this is what we're doing going towards herd immunity, right? The reality is this red is here to stay. These are infectious rates. The goal is to, obviously, I don't even want to really get into herd immunity, because there's a lot of confusion about how this all works with antibodies and things like that. And we can discuss that next week or another time. But today we're going to talk about an action-oriented step, right? And so the action-oriented step to decrease this, to make this red better, in the sense that there's less people that are hospitalized, less people that are sick, and less people who have sequelae or consequences long-standing from COVID. That's what we need to talk about.
All right, next slide. So here are updates from North Florida. Well, first in the United States, we're approaching 4 million. Wow.
That's incredible.
That's incredible. Yeah, 48 million tested. 143,000 deaths, so 1.2 million recovered. We're a hot spot in Florida. We know it in our practice here at North Florida Integrative Medicine. It has been crazy busy with taking care of COVID patients. But in Florida, 3.1 million tested, confirmed 380,000, hospitalized about 23,000, and 5,345 deaths. Here in my county, it's called Alachua County, Dr. Kathleen. Confirmed 2,809, deaths are 15. Here at our practice of 6,000 patients, we've done just about 100 serology tests. 4 have been positive. I suspect that'll go up quite a bit after this week. COVID patients, 12 plus the 4 new ones from today. So we're like 16 COVID patients. I'm actively managing 2 really sick ones that may be transitioning to the hospital, but hopefully not if we do it well. One is actually finishing her stay at the hospital. She got severe. She went into cytokine storm with a pneumonia. She got remdesivir Monday, Tuesday, today, Wednesday, today. She got convalescent plasma through a trial affiliated with the Mayo Clinic. So it's been rough down here.
Yeah, well, she's lucky to have you as a doctor. And, once these things get out of control and anybody ends up in the hospital, it's out of our control. But what we want to do, because we know remdesivir, I was just talking to a Hall of Fame football player, Bernie Kosar. He's from Florida. He played for the Dolphins. And he basically, he's we were talking about health and wellness. He's into health and wellness now that in his mid 50s at last. Well, it's never too late, and it's never too late for any of our followers. So the reality is talking about remdesivir. Remdesivir is necessary. But if we can avoid remdesivir with an intervention like we're going to offer as an action step today, it's a no-brainer, because remdesivir will always, when you see medications on TV and you see it as this side effect, that side effect, blah, blah, blah. I don't know why we take any of them. So the things that we can do that we suggest, Dr. Akey and I typically, are things that don't have any side effects. They're perfectly safe. There are no side effects, and you will get healthier. So the reality is remdesivir is wonderful. It helps. We want to avoid that when possible. And that's what we're going to talk about today.
All right. Well, next slide, I'm just going to finish up with what's happening in Alachua County. And you've seen this before, but I wanted to reassure our population, because there's a lot of COVID out there, that still in the Alachua County, our case fatality rate is very low, 4 out of 1,000. And so that's what I want you to think about. But also at this point, if you're medium or high risk, to shelter in for the next 2 weeks, because really there's a lot of COVID in Alachua County right now. Next slide.
Or if you go out, stay outside, small groups, mask, and distancing.
Exactly. So I wanted to, because I've been messaging this the whole day on telehealth, I just wanted to remind the community about the phases of COVID-19 very briefly, because we have a lot to talk about. But keep in mind that there's 4 phases. Phase 1 is incubation, and that could be from 3 days up to 21 days, but it's usually about 5 days. Once you catch it, you'll probably have symptoms at about day 5. Day 2 is when, phase 2 is when you become symptomatic. Those symptoms are fever, malaise, or feeling tired, cough. It's a dry cough 2 out of 3 times, headache, and diarrhea. And that could go.
And taste and smell, really important.
Loss of taste and smell 2/3 of the time. And this really weird chest pain that happens with this particular virus. So even if your COVID swab's negative and you have those symptoms, then we're going to treat you like you have COVID. So
act as if, yep, act as if.
And then, so this is what this transition from symptomatic to early lung phase is what I've been actively managing for the past week every day on several patients. And this is the thing. There's one patient I managed for 3 days over the weekend at home that she was moving into early lung phase 3. Then when her oxygen was lower, I just couldn't sleep on Sunday. I said, let's go ahead and admit you. And she's the one that got remdesivir and now got convalescent plasma, and she'll be discharged very shortly. There's another patient who's hovering that we're just, at North Florida Integrative Medicine, our protocol is, if you're COVID positive, is to do telehealth with you every day. And the many of you have had COVID swabs that are pending because we're so backlogged. We've called you person under investigation, where we think you're COVID positive, but we just don't have the data back yet. We're also welcoming to see you every day, just to make sure that nothing bad happens. And basically note that in the literature, you can have a simple cold in phase 2, but then get really sick in phase 3. And that's what we don't want to happen. Finally, phase 4 is a late lung phase where the lungs really get taken over in cytokine storm, and you could end up being intubated with low oxygen. We don't want you to go there. In fact, we don't even want you to go to phase 3 at all. So Dr. Kathleen and I really want to fortify your immune system. We wrote it all in our guidebook so that you don't get sick or symptomatic in the first place. And we have had many, many spouses of people whose husbands or wives got sick, and the patients are our patients, and they never got sick. Being fortified with what we talked about the whole time, doing nice exercising, eating, sleeping, C, D, zinc, proline-rich peptide spray. I mean, everything we do to fortify the immune system so you don't get sick in the first place. So I just wanted to review that because there's so much COVID going on in Gainesville right now.
Well, the other thing I want to say about the book, honestly, over time, I'm even more proud of the book because, and I'm not one to just tout things I do, but the reality is that book still contains truthful information and connections to the right information online. So I'm kind of impressed that we could figure that out. I mean, I don't know. My worry was, is it going to become outdated? Nothing in that book is outdated, nor will it be. We're 7 months into this, 8 months into this from the time in Wuhan. This is not getting outdated. And I think that book is the best resource that could possibly be available.
Yeah, and just for our audience to realize that it's not only available as a Google play ebook for $9.99. It's now at Barnes and Noble's, a Nook. Realize that Amazon rejected it because it had COVID in the title, but we're trying to rebut that to get it more widely read. We also have limited edition paperbacks in both of our offices. But really, I have referred so many people to the website because you can get this 14-day incubation monitoring guide for free by opting in with an email. So it's a 14-day monitoring guide. So if you were exposed or if you think you have symptoms of COVID, please take a minute, go to FIRRIMupDoctors.com and download this and share it with everybody. You could feel free to share it with whoever you like. It makes it so easy for us to manage you on telehealth. Remember what I've been saying since March, you need 3 instruments to manage you well on telehealth. That would be a thermometer, a blood pressure cuff, and a pulse oximeter. And you don't have to be frustrated that you can't find pulse oximeters because they're readily available. A lot of the drugstores have them now, and then on Amazon, they're available. So those 3 things, and we can manage you on telehealth. So I actively have currently about a dozen COVID positive patients and only one's in the hospital right now. Next slide. Okay, let's go on to our kick COVID-19 to the curb. Frequently asked question number 17. And just to remind you, these FAQs are what make our document a living document, and it's available on our website as well. Also, our audiobook is done, so we'll probably do a little sample of the audiobook on the website as well. But today's FAQ, how does obesity affect the severity of COVID-19 infection? Okay, so we pulled a study that was published from a European journal, and there was clear correlation. It was from the Italians, European Society of Endocrinology. And basically what they decided was, what they observed was that people who were obese, and that's defined as a body mass index of 30 to 35, were at higher risk for having respiratory failure, meaning lungs not performing and need to be admitted to the intensive care unit. Also, the risk of death was significantly higher if you were morbidly obese, which is a body mass index greater than 35. In addition, there was a higher risk of severe illness among severely obese patients. And, you know, Dr. Kathleen, we were talking earlier about what obesity comes with. There are all of the comorbidities that we worry about with COVID-19, right?
Well, you don't get type 2 diabetes unless your BMI is elevated in 99% of people. High blood pressure is typically associated with a higher BMI. Heart disease is definitely associated with a higher BMI. So the BMI is the root problem. The fat cells, the fat deposition is the root problem. If you have a high insulin, if you have insulin resistance, if you have diabetes, that happens. Insulin resistance happens before diabetes is diagnosed, and insulin always deposits fat. You have a high insulin, you're going to put fat on. Where's the fat going to be? In your abdomen, in your hips, but predominantly you're going to get the apple shape. So the apple shape with the big belly is going to be, it's not your fault. I definitely want to say it's not, I don't believe it's patient's fault. I think it's related to the genome, and it's also related to the lifestyle. So the lifestyle is going to be 80% of this situation. But once that gene with the lifestyle of a little more sedentary, a lot more higher stress with wrong food, on the run, less sleep, no movement, that's going to be what sets you up. So there's 5 things that are going to set you up. It's going to be stress, sleep, food, movement, and genes. 5 things, okay? And it's a combination of things, and it's a perfect storm. And once that sets you up and you get in some resistance, which you don't even know, it's going to build as a perfect storm on itself. But what you need is someone to help you understand, how can you mitigate it? How can you take care of that high insulin and get it down? How can you take care of that plaque from forming in your arteries, causing heart disease, and get it down? Hypertension is not a disease. Hypertension is not a disease. High blood pressure is not a disease. It's a symptom. It is a symptom. We give it a disease category. It is not a disease. It is a symptom that there's pressure in the pipes, pressure in the blood vessels. We can change that. So we can promote fat-focused weight loss. Fat-focused weight loss. Can you imagine? it's really hard to get the fat to come off. It's easy to get the muscle to come off, but we can promote fat focused weight loss. And that's what we're going to talk about today.
Yeah, so we have group medical visits that are on every other Friday, specifically on cardiometabolic fitness and how to avoid the COVID-19 pound weight gain that we've been experiencing. I don't know about you, Dr. Kathleen, some of our patients have been gaining weight because of the COVID. It's either stress eating or feeling like they need more carbohydrates. Have you experienced that in your population where people are gaining weight?
I think I have about 90% who are gaining weight and 10% who have used it as an opportunity to literally lose weight. My son, he lost 12 pounds. His friend, he's at home with his dad. His dad's like, let's go. They're all working out, everybody in their houses as well. I love those stories, but those are not the people who need help. We need to help the people who need support, who need a coach, who need help, who need to know what is it that I can do.
Yeah, so exactly. So most of the patients are struggling, but there are some who are actually spinning the A story and getting healthier being at home. So yeah, I'm always impressed when we see people getting better and healthy being at home. We wanted to introduce something that's very actionable and very doable today. If you are out there thinking that you're out of control with your eating, or if you feel like you just need a hard reset on your metabolism, or if your fasting sugar has been high, which by the way is a separate study from New York City that said that impaired fasting sugar, the higher the sugar at fasting, the higher the risk of complications from COVID-19, kind of going along with the obesity data from Italy. But we wanted to introduce to you the Prolon fasting mimicking diet.
So I think this is an amazing diet, but I want to say something about it's not always the sugar that's off. We don't have a mechanism for measuring insulin every day at home. When you don't feel well if you have sugar issues. I have sugar issues, and over the last several days, I've had stress. I try to mitigate my stress. I'm not a high stress person generally. I don't have anxiety generally. And when you have stress, your sugar is going to go up. My sugar was in the 500s, and I did everything. If I finally broke it, obviously my system was fighting something for 2.5 days. And I had to really, mitigate against that. I did a fasting mimicking approach to get that sugar to come down. That, and along with my other, medications and treatment, I did that and broke the sugar. It went from 500 to 90 in no time. So this fasting mimicking diet is definitely a way to make your metabolic health, the reset that Dr. Akey is talking about, better, to improve a chronic condition. It could be just diabetes. It could be hypertension. It could be heart disease. That's called metabolic syndrome. You will make that better with this. You will get fat-focused weight loss, and you will get a lot of other benefits, and they're all listed here. You will get lower body fat. That's one of the goals. You'll maintain your inflammatory numbers will be lower, and that's really important for COVID-19. The more inflamed you are, the more likely you're going to get sick. Improves your energy, improves your brain, improves your skin, improves your muscle mass, improves your blood sugar, your blood pressure, reduces your waist size, and you get cellular regeneration, stem cell-based rejuvenation. We trigger autophagy, big word, fun word, autophagy, phagy, nyup, 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 self-phagy, nyup, nyup. You go around and gobble up the debris, the garbage, the inflammatory stuff, and you eliminate it. That's autophagy. So Prolon, this fasting mimicking diet that's around 1,000 calories, basically has precise amounts of macronutrients to get rid of damaged cells, damaged tissue, autophagy. And in that process, it turns on fasting. And basically the cells that could be hijacked by any bug, whether it's a mono, whether it's a COVID, regardless of the bug, it will get rid of those cells that were hijacked and will replace them with younger and more effective immune cells.
Yeah, so basically, Walter Longo is he's a PhD who came up with this protocol. He's Italian, so it's kind of Mediterranean, and basically, it's prescribed food in a box for 5 days, and the body sees it not like so many calories, and so you do for the first 3 days you do cellular cleanup or autophagy, as Dr. Kathleen so beautifully said, and the last 2 days you release stem cells, and that's really, really important for being well.
Really healing. Yeah, yeah. Dr. Longo is amazing. He has a whole lab at USC, lots of grants devoted for this. And this diet is used around the country at all the major clinics, Cleveland Clinic, Mayo Clinic, you name it, in order to help people get healthy. So fortunately, the conventional world is using something like this. I've used it with people who had A1Cs of 13 and brought them down to 6, which is pretty remarkable.
Wow, that's amazing.
So that's a fasting sugar of what, 200 or more, and brought them down to a fasting sugar of 120.
There's a question in the chat, Dr. Kathleen. I thought that we weren't supposed to lose weight rapidly while COVID is raging. Can you address that in the context of what we're talking about with Prolon?
Listen, we can't control the rate of your weight loss. Nobody can control that. I wish I could. Your body is going to lose whatever it can lose. If you could lose weight rapidly, bravissimo. The reality is that your body's going to hang on at any point in time. If you lose 5 pounds in a week, it ain't fat. Right now, I'm going to tell you that. It's water. There may be some fat. It may be stool. But if you lose weight over time, and you can turn on cellular rejuvenation and autophagy and begin the cleanup, it's going to be the inflammatory fat cells. So whatever you lose fast, there's no way to lose fat fast. There's a way to lose fat over time. Anything that you lose fast is probably just the fluid that was hanging on to bathe the fat so it doesn't feel so inflammatory to your system. Great question.
Great point. Okay, so we're going to go ahead and move on to Q&A. The other Q&A was, Dr. Kathleen, medium risk people, should they be involved in the vaccines or vaccine trials?
So here's my, again, I think the jury's out. I don't have the answer for that, but let me tell you how things are shaping up in my brain. I don't have the answer. You decide on a vaccine for yourself. I'm going to tell you how that's shaping up in my brain. When we think, I know there's different types of antibodies. There's neutralizing antibodies that supposedly the vaccines have. The main way that it appears, based on recent data as of today that I read, is that there's a dynamic of how antibodies develop and help to fight against a virus. But the reality is that there are neutralizing antibodies as part of that. And you'll hear and read that sometimes the antibodies go down, and they in fact do go down. And in our book, we do a great job of identifying the different parts of the immune system that fight infection. And the coronavirus, COVID, also provokes a vigorous defense from immune cells that kill the virus, called T cells, right? Natural killer cells. We talk about this in the book. And they quickly rouse reinforcements for future battles. They also have a memory. So the vaccine is based on memory antibodies and neutralizing antibodies, but that's only one component of how we would treat COVID. So for me, I'm going to increase my natural killer cells, my T cells. I'm not opting for a vaccine that's quickly produced. I'm opting for what can I do to improve all of the immune cells that I have that fight COVID. And it's all written in our book, the natural killer cells, the T cells, and and that's zinc, vitamin C, omega-3, vitamin D, etc. It's all in the book.
So how could I fortify my immune system army, right? That's the question. And it's written out very explicitly in the guidebook.
Mm-hmm.
I know for myself, I won't be in the first round of vaccine trial. I'd like it to be settled in. And I'm high risk, right? We're frontline. So really individual telehealth discussion with your healthcare professional if you're with us.
Mm-hmm. Yeah, no, I don't want to be the one to tell you what to do, but I'm telling you how important there's many aspects of this to consider. I would never get so narrow-minded to focus on one thing.
Okay, I think we covered the questions that were in the chat, Dr. Kathleen. Thank you so much for joining us from Boston. I'll wrap it up. Nicole had lost her internet. So basically, we wanted to let you know that the prolonged fasting mimicking diet is available on the website, FIRRIMUPdoctors.gethealthy.store if you're interested in that. If you want to learn more about it, you could certainly make a telehealth appointment with any of your healthcare professionals here at North Florida Integrated Medicine, or if you're in Boston with Dr. Kathleen. But I love this program. I use it myself. The protocol is once a month times 3, so 3 months in a row, so 5 days per month times 3, and then once every seasonal change, once every quarter. So especially if you have borderline high sugars, this would be a great place to start to do a hard reset on your metabolism. I also wanted to let you know we're knee deep in the middle of COVID. I got these specifically for our population, but we've opened it up to the public. You can have this whole box for $20 with 3 different supplements. It's called the Basic Immune Packs. Email or call if you'd like it. Finally, like we said, we have our ebook available now, Barnes & Noble on Nook, as well as the Google Play. Please feel free to send it anywhere. Ask your friends and family to watch it, especially if they've been exposed to COVID. We do have some paperbacks available. You could just email. With that, you get discounts on the rest of the supplements, specifically C and Zinc.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupdoctors.com. That's FIRRIM
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.